Hi, it's Kent Burgess, CEO of Your Community Health, here with you and with Tony.
Thanks, Kent. I'm Tony McBride and I'm Chair of the Board.
And we've come together to celebrate the staff and volunteers of Your Community Health as we come up to Employee Appreciation Day, and even more so this year as Your Community Health celebrates 50 years of partnering with our community. And of course, we proudly sit on the land of the Wurundjeri Woi-wurrung people, and we pay our respects to Aboriginal elders past, present and emerging. And we acknowledge our core role in supporting truth and justice and equity for our First Nations people. Thinking about our employees and volunteers and their amazing contribution, Tony, what is it that you think of when you think of the staff and volunteers of Your Community Health?
Well, personally, but I know the board too, we're always really impressed by the work of the staff, the range of work, the range of approaches. When we go around and do board tours, for example, I think the three things that we come away with are a sense of the care that staff have for their clients and for the community, the innovation that's shown and the different ways that people are testing out and trying new ways to work more effectively with the community and make more impact. And lastly, and I think it's really shone through in the last tour we did, was the passion of staff, that people are here because they really want to be, because they believe in the kind of social model of health that the organisation is based on, the sense that people's social conditions impact their health as well and are really important. So we always come away really impressed, and I think I said this at the last staff meeting, that of all the organisations I've worked in and with in health, this actually is the one that I'm most proud to be associated with.
Thanks, Tony. It's very easy to be proud of the staff and volunteers at this organisation when you see that the way that they're truly partnering with and valuing our community members and our community and the work that we do together. And of course, amazing that it's 50 years of Your Community Health, and in the next week we're celebrating the launch of our celebrations for that, and we're also opening our new Your Community Hub and Darabin's Men's Shed, which is going to be an amazing celebration as the organisation celebrates the past 50 years and looks forward to the next 50 years of working with the community that we love so much. I wonder, Tony, what does 50 years of Your Community Health mean to you?
Well, I think it's a couple of things. Firstly, that the work that we do now is very much built on the work of the previous staff and volunteers and boards. I think that was in COVID, there was a great example of that the work that the organisation did in very difficult circumstances with populations and groups and so on who were less connected to the mainstream, weren't getting the kind of services that they should have, that our staff were able to get out there and provide those services because they were trusted. The organisation is a trusted organisation, and that's to do with the current staff and their relationships, but also very much with the previous staff who've built that trust over a long time. So I think that that really came to the fore, and I'm sure the work that the staff are doing now is creating the foundations for future work. But the second thing is that the Victorian community health model is unique in Australia, and the Whitlam government funded it 50 years ago, set up a whole lot of models of community health. The Victorian sector, with its 50 organisations providing community health services at the community level, a broad range of services, is unique in Australia. So our staff work in very special circumstances, I think, and we can all be proud to be a part of that. But I think we offer a really special, broad, rich service to the community that people in other states don't have access to.
Yeah, it's certainly something that we're very proud of at Your Community Health, that we have a strong foundation of working in partnership with our community from a social model of health and having a place-based approach. And we look forward to taking that forward together with our amazing staff, volunteers and community into the next 50 years. Thanks, Tony.
Pleasure.